Well, Jenny, this is actually very, very exciting. We're doing this interview in a way so that your identity is concealed. And we really do appreciate, though, that you're willing to tell your story. Fantastic story, really.
It's a great story.
It really is. And I think it'll be helpful so much to many patients. Patients with multiple sclerosis or patients with cancer who want to have babies. So let me just summarize my understanding briefly. You are diagnosed with multiple sclerosis, and it's very early, and there's a doctor at Northwestern University who has pioneered a phenomenal new treatment that involves a bone marrow transplant to change your immune system, and it really works. Is that right?
Well, it's not actually a bone marrow transplant.
Okay.
It's what they're doing is they're taking your own stem cells.
Okay.
And it's an amazing team led by Richard Burt at Northwestern.
Richard Burt at Northwestern.
And they're running a big trial at the moment. And I'm actually, because I come from England, I'm not part of their trial.
Oh, good.
But I'm getting the same treatment. So essentially, with MS, as we know, it's an autoimmune disease.
Right.
And the theory goes that it's an ablation of your white cells, which is the problem. It's your white cells that are attacking the myelin sheaths that surround your nerves.
So the white blood cells in your body are attacking your myelin sheaths.
Yeah.
So that's why it's demyelinating.
Exactly.
Yeah.
Exactly. So the logic with this is it's an ablative therapy. So they're ablating the white cells, but they're leaving hopefully most of the rest of the red cells and platelets, so other things in the bone marrow. And with chemotherapy, and when there are no white cells left, they give you back your original stem cells, and your body picks up and recovers very quickly. It's obviously quite aggressive treatment, but it's kind of like Control-Alt-Delete. It's a complete rebooting of your immune system. And it's early days with the results in terms of long-term follow-up, but the initial things that they found with not only MS, but with other autoimmune diseases like scleroderma and lupus are absolutely phenomenal.
Really? Well, they're doing it with scleroderma and lupus
Absolutely.
also.
And it's halting the disease absolutely in its tracks. And with a lot of the data showing that there's a regression. So it's the first time any treatment has started to reverse the damage that was done by MS. So it stops the disease's progression, and it actually...
It reverses the damage.
Yeah.
So even, now you're very early, but if you caught it, even after there's some permanent damage, there'll be some regression then.
There will. There can't be a guarantee that you're back to baseline, of course, and
right.
that will be, once fibrotic changes have happened, it will be impossible to reverse that. But there is some reversibility, and that's why it's the better, the earlier you have this treatment. Unfortunately, because it is so aggressive and not many people are doing it, it ends up being people who are further down the line with their MS. So I'm actually the first patient that they're ever going to be doing who's I could run every day if I needed to. I'm very fit and well, but I do have quite a few lesions in my brain and on my spinal cord, and I've only had the disease for a few years, but we can see it's quite highly active.
You have all the objective imaging diagnoses of multiple sclerosis, but you seem to be doing very well. You haven't really deteriorated yet.
Exactly. So I have relapses and remissions, but I haven't started to progress.
When you have a relapse, is it like a visual relapse or nerve pain? Or
it's more pain, sensory changes, and then weakness in my legs. So it kind of depends on which part of the body it's going for at that time.
Exacerbations and remissions, that's what multiple sclerosis is about. But after this, you'll have no more of that.
I'll have no more, exactly. There is a possibility that I may have the odd flare-up at times, but my neurologists don't think that will be the case at all. But I suppose it's important to be realistic, that the disease will stop, but there may be something in the early phases as my immune system is starting to rebalance itself. So the first couple of years, you're really sensitive to infections, and you have to lead quite a puerile lifestyle.
Now, Dr. Richard Burt, is he in like rheumatology or neurology? Or
he's an immunologist.
He's like a rheumatologist, an immunologist, is that right?
Yeah.
But he's going to be dealing with whether it's MS or whether it's lupus or scleroderma or polyarteritis nodosa or...
Absolutely, and I think he's been working for many years on autoimmune diseases, but now that they've got this big trial with the MS, it's taking up quite a bit of his time, but I know he's continuing with all his other autoimmune illnesses.
Well, this is huge.
It's amazing, it really is.
But now, here's the thing, did he warn you, or what are you doing here?
Well, what I'm doing here, so the downside, of course, that the big upside, I could cure this disease and never have any problems at a very early age and continue I'm a doctor and continue in my great profession as well. But the downsides, and of course there must be some, the main one being fertility. So the chemotherapy is very high doses, and it's ablative, meaning that it will, in all likelihood, render anyone kind of towards their late 20s, early 30s infertile and menopausal.
Sterile, not just...
Sorry, sterile.
Sterile, in other words, menopausal.
Absolutely menopausal.
Yeah.
So that would be a huge downside, of course, and may deter a lot of young women from doing this treatment. So people would end up waiting till after childbirth. There is some evidence out there that is probably an increased time for relapses with MS, and there is a small amount of evidence that shows possibly after childbirth relapses then might be even more damaging. So we never know, whether to have your child first or whether to have treatment, and it's all about the sterility and fertility. So for people of childbearing ages, especially someone like me who's never had a kid, it's a big thing to put into the equation. And I think it was our the only reason we might have delayed this treatment. But we decided to go ahead, and we then went on a wild mission to do all we possibly could to preserve my ovaries. And that's where you came to the rescue.
Did the doctors know about this?
No, none of the doctors. Doctors are so wonderfully super specialized nowadays,
right,
that you create your own journey as a patient. And I've been the one I've been the one who went and found what was going on in Chicago with Dr. Burt through my reading, and with my husband and my family. And the same thing as with you. We knew there was somebody doing something amazing. It was just a case of finding them. So I knew someone would be doing ovarian cryopreservation and having live births afterwards. And very quickly your name came up.
Yeah.
So no, they didn't know anything about it. There'd been no advice. People have advised you to go through a cycle of IVF. But that can hugely exacerbate your MS to take all the hormones that are required for IVF. So it comes with a bit of a caveat.
That's as risky as getting pregnant, really, before.
Definitely.
So how did your IVF cycle go? This was in England, right?
Yeah, so I did a cycle of IVF in England, and it was hard work, and my MS was not great. It was short. The fact that I was only doing one cycle meant that it was bearable, but I only got 10, very high quality embryos, but there are only 10. And the stats are going to show 50% of them will not survive thawing. And then, it could be that I've got a 20% chance or less of having one of those even successfully implanted.
You might have a 20% chance of pregnancy from that.
So that's not a lot,
right,
for a woman who wants a few kids down the road.
And then if you went through 5 or 6 cycles of IVF,
I don't think I would have tolerated one more cycle.
You couldn't have tolerated that.
No.
So it's easier just to have one ovary freeze. We'll be freezing basically 100,000 eggs. And you're all set, so you don't have to go through hormones, you don't have to delay things.
And we only did the hormones as a backup because there was such a short time window, and you've all been absolutely amazing at squeezing me in. But we didn't know back then whether that would all work out. So we thought, look, let's just get some embryos banked. But if I'd known I'd be here and be with you, I would not have gone through that.
Yeah, because we do the ovary removal today. This is a Friday, and you're starting your treatment on Monday.
Yeah,
is that right?
So
there really isn't any delay in treatment if we do it this way.
No delay whatsoever.
Right, so. Fantastic. Well, so this is one of the problems that we have with oncology patients, with cancer patients, is the oncologist may know that ovarian preservation is a possibility, but they poo-poo it, or they de-emphasize it, or they say to the patients, well, don't worry about that. Let's just try to treat your cancer. And they say that to 23-year-old women or 17-year-old girls and their parents. And they really, throughout the world, it's everywhere. There's no particular place we can indict. But it seems like particularly the male oncologists don't understand. Explain how it would feel to tell you, oh, well, no big deal, you're not going to be able to have children.
I guess the thing is, for me, I'm in a slightly different subset because I chose to have the stem cell treatment at a very early stage when I'm not desperate about my MS. I know it's going to get that way, and I want to stop it now. And I suppose when you get a diagnosis of cancer, the first thing that comes is treatment, cure. And I think that at that moment in time, maybe people aren't as worried about their potential, their sterility. But of course, the second you're cured, that's the only thing that matters. And I think it's absolutely devastating. And there's a lot that you may be saying at the time that doesn't matter, but I think deep down, every woman, it will be a terrifying idea. Even in the big context of cancer and chemotherapy, there is something inside of you that knows that you may be losing the ability to have children. And that's a really big thing for us. Well, for everybody. So I think actually I haven't had any advice from anyone particular, except one male oncologist, surprisingly.
A male oncologist?
Indeed, but he's not my oncologist. He's sort of
a
my
colleague. Yeah.
He's a surrogate godfather. He's the reason I did medicine, really. And he has been saying from day one, forget everything. You get your ovary taken out, you get it frozen.
Oh, that's fabulous.
But he really cares about me, and he thinks me and my husband are born to have children. So I think I've been very special that I've had people along the journey who have really looked out and have put wonderful ideas into my head. But you're so right, everybody else I know who's gone through cancer treatment, and I know a lot of people, or the potential people who are going onto this trial or having anything innovative, fertility is just one of those things that gets onto the byproduct.
There's a well-known bone marrow transplanter who basically doesn't send any of his patients to have fertility preservations for the reason we mentioned, except that when one of his nieces needed it,
exactly,
he sent her to us.
I bet you. When it really matters, then you're going to think, oh wow, this is and that's the awful thing about medicine. You're doing the best thing you can at that moment in time for your patient, but you're unable. Doctors can't take into consideration every part of their facet of their life in the future.
Blinders on.
Yeah, exactly. You say, get the cancer out, fix it. But fertility, I'd say, is as important, because that's the thing that's going to affect your life later.
Yeah, so, and you're 33.
31.
31.
Don't put 2 years on me.
Oh, now you hate me, yeah.
It's right because I haven't slept.
2 years I had. I'm sorry about that. But, so many of our cancer patients come to us 5 or 6 years later. Because, you're lucky. You got married young, and but so many women aren't finding the right man until they're 40.
Yeah.
But so what are they talking about in coffee? Well, they're all talking about their biological clock. Yeah. So my cancer patients, we started doing this in 1997, so that was like 14 years ago. And they all say, I feel so fortunate that I had cancer. Because otherwise, I think with my lifestyle and my career, that I'm not going to really think about having babies till I'm 40, nor my girlfriends, but they're all worried about it. But I tell them I have a 17-year-old ovary in the freezer, so I'm not worried.
Well, actually, all my friends are sort of now waking up thinking, oh, we should be doing something. Wow, we're not going to have kids until our late 30s or 40s. So it is a strange position to suddenly be in, thinking, I'm going to be more fertile than everybody else.
Yes, you will be. You can be really relaxed about it.
I have to just relax my husband now and say, easy, not yet.
Well, that's fantastic. Now, there's a funny part of the story that I don't know if we need to include in the interview, but I'll throw it in anyway. This is so coincidental, because you just researched this and found us out of the blue. But we're related almost.
Exactly.
Yeah. In a way. Tell that story. It's fantastic.
Well, Dr. Silber was the pioneer in treatment on my father. God, was it 17 years ago?
Yeah.
For a reverse vasectomy, a very complicated procedure with lots of other issues, and was responsible for producing my wonderful 2 younger siblings. And your name has always been something wonderful in our household. And when my father started to put his nose into my fertility, I said, you just leave this to me. I'm going to find the world's specialist. I'll find the guy who's doing... And of course, it turned out being you doing both. So we had a good giggle to ourselves.
Isn't that that is
amazing.
A riot. And I remember that he was a very difficult case. If you ask him, we had to extend the incision. We had to go vasta epididymis because he had blowouts in the epididymis. So it was a difficult case. And we had people in Brussels watching. And we were doing a lot of teaching with that, just letting people see how we do difficult cases. And and I've got the video of it that I never prepared a DVD out of, but we are in the process of getting you a DVD of your father's operation that we did 17 years ago. And,
watch it over, family supper.
This is very, very, very funny.
Isn't that amazing?
And, so I feel like I'm part of your family.
You are.
I am. So. And I'll be responsible now for his grandchildren.
Absolutely. Isn't it the cycle completes, or circle completes even?
It's a thrill. Well, we're going to do the operation very shortly. I don't know, do you have any advice either for MS patients? My mother-in-law died of MS. It was very sad. MS is a frightening condition. For MS patients or cancer patients or anybody with autoimmune disease?
I think fear is debilitating. And I think that's the worst part of all these awful illnesses, is what they actually do to your psyche and your emotions and your ability to see the future and move forwards. So I think that one has to sometimes take the ball into your own hands, But it's about looking for all sorts of things that are going on and exciting endeavours, and not being scared to go with things that look right. I think that there will be cures for these diseases very shortly. I feel very lucky that I'm with a team now who I think are doing the most groundbreaking things. And if there's a problem, if you look hard enough and you want it enough, there will be some sort of a solution. It may not be perfect, but I think the important thing is to be very hopeful and to try your very best not to be scared, because being fearful, I think, means everything looks a bit grey.
Well, that's fantastic advice, and I think we really do have this thing so, at least the fertility part of it, I think we have this thing so worked out and simplified now.
Well, this seems to be like the easiest bit of everything. It looks wonderful.
This is a piece of cake, really. You're going to have a little pain for a few days. It won't be too bad, though. Yeah,
but we've got some good pain tablets, so, I'm sure I'll be absolutely fine.
That's great.
Great.
Well, all right, we'll get going on it now, and maybe I'll talk to you afterwards.
Perfect. Well, if we don't, thank you for everything.
Okay, my
Amazing.
pleasure.